Good morning. Happy Friday, everybody. I'm Leslie Krigstein. I'm CHIME's Vice President of Congressional Affairs, and I'm excited to share this beautiful morning here in Washington with you. We are rapidly approaching the time during which lawmakers head home and go back to their districts for a lengthy recess period. The House should be headed out of town as early as this afternoon, and we're expecting the Senate to follow suit next week. So there will be ample opportunities for those back home interactions with your members of the House and members of the Senate. So they're getting out of town just in time as the temps have skyrocketed. And there has, of course, been some late breaking drama. So it's been a busy few weeks, a few months. I think 2019 has really been a non-stop policy-filled extravaganza of sorts with, marquee rules coming out of ONC and CMS addressing interoperability. We've got Congress looking at all things from surprise medical billing to drug pricing, with hearings on interoperability and health IT, and of course, privacy has really taken root as we're awaiting, further action from Congress on what the future of data privacy legislation and policy should look like. And there's also a lot of unfinished business. So as I mentioned, Congress is about to head out of town, which for folks like me means we get to breathe a little bit. But we don't have any of the appropriations bills for 2020, which is fiscal year is just around the corner. The fiscal year, has been a bit of a hurdle for us to meet those deadlines the last few years. But we're anticipating one of the very first things that the Senate will do when they return in September after Labor Day, now that we do have this large bipartisan 2-year budget deal that was announced by the president and congressional leaders earlier this week to kick off the sequestration cuts. So that's good news for us. We know how damaging the sequestration cuts would be for healthcare. So that deal, the House passed yesterday. We're expecting the Senate to take up next week. So that will give the Senate appropriators the direction that they were waiting for to be able to understand how much they should be budgeting toward. So why is that important? Well, of course, we want to make sure that HHS is funded, that we've lived through a few government shutdowns in recent years, and hopefully we'll be able to avoid that either through passage of the appropriations bills, the funding bills, or a continuing resolution, which are those stopgap measures that we've become so well acquainted with in recent years. But one of the big things that we will be tracking closely as the Senate acts and ultimately as the House and Senate go to conference on their funding packages for health and human services is that we all remember so well in this CHIME community that the House, for the first time in almost 21 years, took out the long-standing policy rider that prohibits HHS from spending any money on developing or adopting or implementing a unique patient identifier. So, we're watching what the Senate does closely. We're working with our colleague organizations here. Just this week, earlier this week, it's amazing how time flies here. But on Monday, we were thrilled to join our friends from AHIMA, from AMIA, from the American College of Surgeons, and having a briefing on Capitol Hill outlining why it is necessary that funding ban on a unique patient identifier go away once and for all, and what that means for patient safety, patient outcomes, interoperability, cost containment. And CHIME was fortunate to be represented by Mark Probst, the CIO of Intermountain Healthcare, and he really articulated how his health system is grappling with the challenge and how, the lack of action has definitely had some tangible consequences for patients, for the industry, and why it's critical that we act. So you may have seen in the CHIME community on Monday, we urged you all into action, whether you work in a health system, whether you work within one of our CHIME Foundation partners. It's critical that the Senate hear from you all, whether it's a phone call, whether it's a tweet. We know that tweets change the world these days. So whether it's leveraging social media, writing a note, sending an email, it's really, really important that your Senate offices are hearing from you with your perspective on why being able to have HHS at the table and engaging meaningfully on how we're going to move forward and identify patients across the care continuum is critical. So if you have any questions, you want more information, please, you can always reach out to policy@chimecentral.org. We'll include the toolkit that we put together, which has some language that you can use on social media, can use on the phone, can use in emails or letters. And having worked on Capitol Hill, having seen the 90,000 letters that my then boss received annually, I can say that offices take them very seriously, and they will keep tallies of how many they've gotten on a particular issue. And on something like this that may not be mainstream for most congressional offices, if they're getting 2 or 3 or 5 or 10 messages from a health system or from CIOs in the state or from, anyone in the state, frankly, they're going to take notice, and they're going to go to the boss and say, hey, we better make sure that we are satisfying our constituents' interests. So that is a very long plea from me, from the CHIME organization, to really be willing to put yourself out there, to share your experience, to tell your stories about why something like patient identification and interoperability is so paramount in our industry and our world for our patients today, and why Congress needs to act. So that's one reason why we're paying really close attention to how this appropriations process progresses. Because if the Senate doesn't take it out, then they will go to conference with the House, and then they'll have to really, it's going to be a push and pull on who is willing to really go to the mat for this issue. And because it isn't something that many members are familiar with, it's going to be critical that they've heard from as many constituents as possible to know that this is really, really important. This week, we also saw the Senate Finance Committee pass out of committee a drug pricing bill, which ordinarily isn't something that CHIME would cover, but of interest may be the fact that it does include a directive for HHS to move forward with mandating real-time benefit tools for Medicare Part D, so patients are getting real-time information about their drug benefit. This also has a tie into ONC, and they say it should be part of ONC certification program. And then they also tie it into the MIPS program, so providers would get credit from the as an improvement activity. How there are that lengthy list of improvement activities that providers who are participating in the quality payment program, MIPS program, can pick from. So it's something that we'll definitely watch. It's not abnormal to see some technology provisions sneak into some of these broader legislative packages, but this was definitely one that we'll keep an eye on, and I wanted to flag for our CHIME community. And we're also still continuing to track what the Senate Health, Education, Labor, and Pensions Committee is doing. We've endorsed that legislation. It is a very comprehensive package that addresses everything from surprise billing to some drug costs to some interoperability and health IT things. Like they look to codify the CMS interoperability rule for insisting that payers start to be interoperable and share the data they have with patients and with all of those who need it, as well as calling for a government accountability study on third-party privacy and security risks. So that's something that we are covering really closely. We saw the FTC this week come out with their big fines for Facebook. Of course, there's ongoing activity in the Senate Finance Committee, the House Energy and Commerce Committee, the House Judiciary Committee. We know that there's a lot of interest on the Health Committee on health data privacy. So privacy really has gotten so much attention this year, and we expect that to continue as the year progresses and when lawmakers return from recess, because I think we're going to see a lot of staff level conversations during this recess time to start to arrive at some policies that they may be able to consider before the end of the year. On the administration side, we're waiting with bated breath for some rules to come out. We were really excited a few weeks ago that the FCC is now moving forward with rulemaking on a expanded telehealth and connected care program for underserved communities and veteran populations in particular. So CHIME's putting together a telehealth work group that we would love folks to join. Those dates will be in our Washington debrief this week. We're also standing up an artificial intelligence work group. We've seen the White House put out some guidance and executive orders. There's a few bills on Capitol Hill. NIST is doing some work. So we're really starting to see the proliferation of conversation about AI. And we're hoping that we can lend some perspective for what AI means for healthcare. So we're standing up that work group as well. And then really with a congressional focus, but we'll definitely touch on some of the broader policy issues. We're going to stand up a privacy working group. So there was a specific bill introduced by Senators Amy Klobuchar and Lisa Murkowski earlier this summer that looks really at developing new rules and expectations for third-party applications for wearables for direct-to-consumer genetic testing on the treatment of the data generated that ordinarily would probably be HIPAA covered, but because of the nature of those entities, it isn't HIPAA covered data. So how is that data being treated, being protected, being shared? So we're going to take a look at that bill, as well as probably prepare some general principles. So as the privacy conversation on Capitol Hill progresses, we have some resolute recommendations that we can show to lawmakers and say, this is, what the health IT leaders are thinking in terms of the forward direction of healthcare privacy and how you need to act or not act, depending on how things shake out. So there's really a lot of opportunity. The physician fee schedule rule that will include the quality payment program should be out any second now. It's been at the Office of Management and Budget for a number of months, and we've gotten word that it's been released, so to speak, so that should be out today or tomorrow, or today or Monday, most likely. And there's going to be more and more as the year progresses. A lot of these rules that have been proposed are going to need to have follow-on rulemaking, follow-on conversation. There's a number of meetings happening later this summer. ONC is having a meeting here in DC the week of October 19th that I also believe has virtual components. If you're not able to make the trip to DC, take a look at that. And there's just really never a dull moment. So whether it's NIST churning out new cybersecurity resources or MIPS and ACO data from 2018 being shared back into the community, definitely keep an eye on our Washington debrief on CHIME's, whether it be Facebook or LinkedIn or Twitter. We try our best to do real-time updates, if at all possible, with the membership so they are in the know as soon as we are. So our policy door is always open. Please always feel free to reach out. You can find myself as well as my colleague Mari Savickas, who handles our agency activity at policy@chimecentral.org. We're happy to answer any questions that you may have through the course of your kind of digging into policy, or if you have a very specific technical question stemming from the Promoting Interoperability Program or on a quality measure, we can be helpful to you. So please know our door is always open, and we are always happy to talk to members and foundation partners as well. So with that, I'm happy to say goodbye and happy Friday. Have a great weekend. Please try to go out and find your members of Congress while they're home in the district. They generally are way more accessible there and open to hearing from you. So if you want help getting in touch with them, finding those, coffee on your corner or inviting them to come tour, give us a shout. We're here for you. So thank you so much. Have a great rest of the day, and everyone stay cool out there.